There are currently 58,000 Arkansans over the age of 65 living with Alzheimer's. With this number expected to increase, it is important the state to take steps to begin prioritizing its response to Alzheimer's and other dementias. Today, David Cook is going to explain to us, he's with the Alzheimer's Association, on really the very first step. First is get the bill passed, which it did, but also something that you put together.
Yes, ma'am. So Act 391, which we passed last legislative session, it creates the Alzheimer's and Dementia Advisory Council. And that's the big first step that the state can take to begin prioritizing its response to Alzheimer's and other forms of dementia. Having a permanent council like this in place will make sure that issues that impact folks with Alzheimer's and other forms of dementia constantly stay at the forefront of legislators' minds as they make decisions about public health and how to improve our response again to Alzheimer's and other forms of dementia here in the state of Arkansas.
And really, from the very beginning, when you and I met, it's to have this conversation, and not just the conversation with us, but to have it with people who can make decisions. Like senators and legislators, right?
Exactly. It's very important that our issue, and they hear from people in their district that is impacted by this disease. And they already know that Alzheimer's is having a huge impact in Arkansas, but they need to hear stories about how it's impacted their families, how it's impacted the challenges that you face as a caregiver, difficulties in getting diagnosed, and just accessing services that you need to help you in the community as well.
It is a very broad topic.
It is very broad.
It is very layered in how dementia works with different people. You and I were just talking, your dad's diagnosed with vascular dementia or Alzheimer's. My mother has Alzheimer's. So our conversations, it felt good to be a part of your advisory council, not the council, but the committee,
right,
because I could actually discuss it with people like Senator Bozeman and others, and I felt empowered. And that is the goal of a lot of people who you've asked to be an advisor, but we need more of those. We
certainly need more of those. We need more advocates, people who are willing to engage on the political level to make their voices known and get their stories heard. We are very hopeful that with the establishment of the council, we have a diverse group of healthcare professionals around the table. And again, we're hopeful that the state will start looking at things that we can change concretely, like getting more public awareness out there around our issues and the importance of dementia diagnosis, early detection and diagnosis. And we look forward. We think that the fall is going to kick off. We think the council will begin its work here in the next month or so, and we're excited about getting engaged and starting to make some of these substantial changes.
And I'm excited too. And if you want to be a part of this movement, please contact the Alzheimer's Association. Talk to people like David. He does the hard part, but he needs you. But he'll explain to you how you can help. Thanks again for being here.
So for more information, if you want to text AIM AR to 52886, you'll sign up to hear weekly updates from us. So please text out AIM R to 52886.
Thank you.